Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Hello, Mihira. I understand you've been experiencing some troubling symptoms. Could you tell me what's been going on?
Yes, thank you, Dr. Daniel. So, it's been, about 4 or 5 months now, and I've been having these persistent issues. At first, I thought it was just a regular cold, maybe some allergies, But it hasn't improved. In fact, I feel it's gotten progressively worse. My nose feels constantly blocked, like, not just congestion, but completely obstructed at times, and I find it almost impossible to breathe through it. And then there's this intense pressure around my face, mostly across my forehead and around my cheekbones. It's like a heavy, dull ache that just doesn't go away. Sometimes, the pain radiates all the way down to my upper jaw, which makes it really hard to eat or even talk for long periods. I also have this strange sensation in my sinuses, almost like a weight pulling downwards. I've noticed my sense of smell and taste are severely diminished, too, which makes food taste bland. It's all just very frustrating and exhausting.
I see. And do you experience these symptoms continuously, or do they come and go?
Well, that's the odd part. It's pretty constant, but sometimes, especially at night, it feels like it intensifies. I've tried lying on the side or propping myself up with pillows, thinking it might help with the congestion, but it only provides minor relief. The blockage seems to worsen when I'm lying down. There's also a lot of mucus, yellowish, thick, and sticky, and occasionally, I feel like there's a bit of blood in it, which really worries me. And I forgot to mention, I also have this nagging cough. It's mostly dry, but occasionally I do cough up some phlegm, especially in the mornings.
Thank you, that's very thorough. Have you tried any treatments or remedies up until now?
Yes, quite a few actually. At first, I tried over-the-counter decongestants like pseudoephedrine. Those didn't do much, honestly. Then I moved on to nasal sprays, saline rinses, you name it. I even tried a corticosteroid spray, which my pharmacist suggested could help with inflammation, but after a few weeks, I didn't notice any improvement. I've also tried steam inhalation with eucalyptus oil to clear my sinuses, and while it does provide some temporary relief, it's short-lived. I even tried some herbal remedies like turmeric and ginger tea, thinking it might reduce inflammation, but again, no luck.
Right, and how about your medical history? Any history of respiratory issues, allergies, or surgeries in the past?
Well, I've had asthma since I was a teenager, but it's generally well controlled with my inhaler. I've never had any surgeries or major illnesses. I do get seasonal allergies, but they usually resolve by the time spring ends. This feels different, though, more persistent and intense. It's also strange because I feel exhausted all the time. I don't know if it's due to the lack of sleep from not being able to breathe properly at night, or if it's part of the condition itself.
Thank you for that. From what you've described, Mihira, it sounds like you might have nasal polyps, which are non-cancerous growths in the lining of your sinuses. They can cause symptoms similar to what you've been experiencing.
I've never heard of those.
To confirm this, I'd like to conduct a few examinations. An endoscopy would allow us to visualize any of it directly. Additionally, I may order a CT scan of your sinuses to assess the size and location of any polyps and to examine the extent of any inflammation or blockage.
All right.
Extract 2. Questions 13 to 24. You hear an occupational therapist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Hello, Mihira. I'm Ralph Lester, your occupational therapist. Nice to meet you. What brings you in today?
Hello, Mr. Lester. Well, I'm here because I've been experiencing ongoing pain and stiffness in the wrists and hands. It's been making everyday tasks quite difficult. I'm worried it might be something serious.
I see. It sounds uncomfortable. Could you tell me a bit more about how this is affecting your day-to-day activities?
Sure. The stiffness, especially in the mornings, makes it nearly impossible to hold things firmly, like a cup of tea or my toothbrush. By the end of the day, the pain intensifies, and there's a sort of throbbing sensation in my joints. Even tasks like buttoning my shirt or typing have become a struggle.
I understand, that must be very frustrating. Have you tried any treatments or medications for it?
Yes, I've tried a few things. A friend recommended glucosamine supplements, but I haven't seen any difference with those either. My GP prescribed me ibuprofen to help with the inflammation, but it only provides temporary relief. I also tried some hand exercises and even wore wrist splints at night, but I'm not noticing much improvement.
Thank you for sharing that, Mihira. Have you had any other health issues recently, or has this condition worsened over time?
Well, I do have a history of joint issues. I was diagnosed with mild osteoarthritis in the knees about 2 years ago.
That's helpful to know, as osteoarthritis can sometimes affect multiple joints over time. Based on what you've told me, I'd like to start by conducting a few assessments today. These will help us understand your current range of motion, strength, and any functional limitations. We'll also need to get some X-rays to look at the condition of your joints more closely.
That makes sense. I want to make sure we're on the right track and not missing anything important.
Absolutely. Once we have the results, we can create a targeted treatment plan. For osteoarthritis, treatments can vary, but we often see good results with regular, structured exercises that build strength and flexibility. I'll teach you some specific exercises and stretches to improve hand mobility and reduce stiffness.
That sounds helpful, but will it be a long-term process? And will I need to take any additional medication?
Generally, yes, osteoarthritis management is a long-term process. As for medication, we may continue with anti-inflammatories if needed. If we start physical therapy now, with exercises 3 to 4 times a week, we might see improvement within a few months. There's also a possibility of corticosteroid injections directly into the affected joints if the pain doesn't improve.
I understand. Thank you for explaining everything so clearly, Mr. Lester.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a physiotherapist called Mihira talking to a doctor. Now read the question.
Dr. Lewis, I'm concerned about Mr. David's progress in physiotherapy. He's not showing significant improvement in his mobility and strength.
That's concerning. Mihira, have you adjusted his treatment plan to address his specific needs?
Yes, we've modified his exercises and increased the intensity, but his progress remains slow.
We might need to explore alternative treatment options, such as electrotherapy or hydrotherapy. These modalities can help reduce pain and inflammation and promote healing.
That's a good idea. I'll discuss the options with Mr. David and see if he's open to trying these therapies.
It's also important to address any underlying medical conditions that might be hindering his recovery. Mihira, have you considered consulting with a neurologist or rheumatologist?
That's a valuable suggestion. I'll discuss the possibility of a referral with Mr. David.
Remember to monitor Mr. David's progress closely and make adjustments to his treatment plan as needed. We want to ensure that he achieves the best possible outcome.
Now look at question 26. You hear a doctor called Mihira talking to a nurse. Now read the question.
Nurse Lewis, I'm concerned about Mr. David's condition. His vital signs are deteriorating, and he's showing signs of sepsis.
That's concerning. What are the early signs of sepsis?
Early signs of sepsis can be subtle and include fever, chills, rapid heart rate, and confusion. It's crucial to identify and treat sepsis early to prevent severe complications.
How can we prevent infections that can lead to sepsis, Dr. Mihira?
Proper hand hygiene is essential to prevent the spread of infection. We should also follow strict aseptic techniques during procedures and maintain a clean environment.
Are there any specific risk factors for sepsis?
Individuals with weakened immune systems, recent surgeries, or chronic illnesses are at higher risk. It's important to monitor these patients closely for signs of infection.
Dr. Mihira, what are the potential complications of sepsis?
Sepsis can lead to organ failure, septic shock, and even death. Early recognition and prompt treatment are crucial to improve patient outcomes.
Now look at question 27. You hear a GP called Mihira talking to clinic staff. Now read the question.
Team, I want to emphasize the importance of maintaining strict hygiene practices to prevent the spread of infections. This includes proper hand washing, wearing appropriate personal protective equipment, and cleaning and disinfecting surfaces.
I understand, Dr. Mihira. We should always wash our hands before and after patient contact.
Exactly. Hand washing is the most effective way to prevent the spread of germs. Use soap and water and scrub your hands for at least 20 seconds.
What about using hand sanitizer?
Hand sanitizer can be used as an alternative to hand washing, but it's important to use it correctly. Apply a sufficient amount of sanitizer and rub your hands together until they are dry.
Should we wear gloves for every patient interaction?
Gloves should be worn when there is a risk of exposure to bodily fluids. However, it's important to remember that gloves are not a substitute for hand washing.
Dr. Mihira, how often should we clean and disinfect surfaces?
We should clean and disinfect surfaces regularly, especially after patient contact. Use appropriate cleaning agents and follow the manufacturer's instructions.
Now look at question 28. You hear a nurse called Mihira talking to junior nurses. Now read the question.
Good morning, team. Today, I want to emphasize the importance of punctuality. It's a crucial aspect of professionalism and patient care.
I agree, Mihira. Being on time shows respect for our colleagues and patients.
Exactly. Punctuality not only reflects our commitment to our work, but also ensures smooth workflow and efficient patient care. When we're late, it can disrupt schedules, delay procedures, and cause inconvenience to patients.
What are some strategies to improve punctuality?
Planning and time management are key. We should prioritize tasks, set realistic deadlines, and avoid multitasking. Additionally, it's important to anticipate potential delays and plan accordingly.
What about unforeseen circumstances, like traffic or unexpected patient needs?
In such cases, it's essential to communicate with our colleagues and supervisors in advance. Transparency and honesty are crucial.
How can we motivate ourselves to be punctual, Mihira?
Setting personal goals and tracking our punctuality can help. We can also reward ourselves for achieving our goals. Remember, punctuality is a habit that can be cultivated with consistent effort.
Now look at question 29. You hear a dentist called Mihira talking to a colleague. Now read the question.
Have you heard about the new regulations regarding patient privacy and data security?
Yes, Dr. Mihira, I've heard a bit. It seems like there are stricter guidelines now.
Exactly. We need to be more vigilant about protecting patient information. Any unauthorized disclosure of confidential data could lead to serious consequences.
How will this affect our daily practice, Dr. Mihira?
We'll need to implement stricter access controls for patient records. Only authorized personnel should have access to sensitive information. Additionally, we'll need to ensure that all electronic health records are encrypted and backed up regularly.
What about sharing patient information with other healthcare providers?
We should only share patient information with other healthcare providers on a need-to-know basis. We must obtain patient consent before sharing any sensitive information.
How can we ensure that our staff members are aware of these new regulations?
We can conduct regular training sessions to educate our staff about the importance of data privacy and security. We can also develop clear policies and procedures to guide their actions.
Now look at question 30. You hear an occupational therapist called Mihira talking to a senior doctor. Now read the question.
Dr. Lewis, I'm concerned about the limitations of our current rehabilitation facilities. The increasing number of patients is straining our resources and affecting the quality of care we can provide.
I understand your concern, Mihira. We've been facing similar challenges in other departments as well.
We need more specialized equipment, such as advanced therapy machines and assistive devices, to meet the diverse needs of our patients. Additionally, we could benefit from increased staffing to provide individualized attention.
I agree, Mihira. We'll need to advocate for additional resources and funding to address these issues. We can also explore alternative solutions, such as telerehabilitation or partnerships with community organizations.
I'm worried that the current limitations may impact patient outcomes and prolong their recovery time. We need to ensure that our patients receive the highest quality of care.
We'll work together to find solutions and improve our rehabilitation services. We'll prioritize patient needs and advocate for the necessary resources.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a diabetologist, Mihira, and an interviewer.
Dr. Mihira, thank you for joining us today to discuss your expertise in diabetes and the fascinating area of reverse diabetes. Let's begin with the basics. Could you explain, in brief, what reverse diabetes entails and how it differs from traditional diabetes management?
Certainly. The term reverse diabetes refers to a significant reduction in blood sugar levels to non-diabetic ranges, often without the need for medication. While traditional diabetes management aims to control glucose levels through lifelong interventions like insulin and oral medications, reversing diabetes suggests the potential to reach a level of blood sugar regulation where medication may no longer be necessary. It's crucial to understand, though, that reversal is a long-term commitment and requires ongoing lifestyle changes, often combining diet, physical activity, and, sometimes, psychological adjustments. Unlike type 1 diabetes, which is typically irreversible due to a lack of insulin production, some individuals with type 2 diabetes, under the right conditions, can achieve this form of remission, at least for a period.
That's fascinating, Dr. Mihira. In your recent study on reversing type 2 diabetes, what did you uncover about its success, and what patterns were evident in those who managed to reverse it?
Our study revealed a multifaceted and complex picture. We observed that around 30% of participants reached a state we define as diabetes remission, where their HbA1c levels dropped below the diabetic range and were maintained without medication for at least 6 months. Notably, there wasn't a one-size-fits-all pattern among those who achieved remission. Some participants adopted a low-carb diet, others increased physical activity, and a few emphasized mental health improvements. Interestingly, those who achieved remission showed a strong correlation with sustained, rather than drastic, lifestyle modifications. This aspect was crucial. Gradual, consistent changes led to far more sustainable results than extreme, short-term measures. Our data suggests that flexibility within structured changes, allowing individuals to find their optimal approach within certain parameters, was a defining factor for success.
The varied approaches are intriguing. What might be causing these differences in how people successfully manage or even reverse their diabetes, Dr. Mihira?
That's an excellent question. The variance, as we analyzed, seems tied to individual metabolic flexibility, a somewhat new concept in diabetic research. Metabolic flexibility is essentially the body's ability to adapt to different fuels, whether glucose or fat, depending on what's available. For individuals with higher metabolic flexibility, dietary changes, even if moderate, can lead to more substantial impacts on their blood sugar levels. Moreover, personal genetics, microbiome composition, and even psychological resilience all seem to play roles in how each person responds to lifestyle adjustments. For example, certain people have gut microbiota that may respond better to high-fiber diets, promoting more stable blood sugar levels. These findings reveal that reversing diabetes is likely a highly individualized process, dictated by both biological factors and behavioral adaptation.
With all of this in mind, Dr. Mihira, what would you consider the game changer in terms of reversing diabetes?
If I were to pinpoint one game changer, it would be the rise of personalized interventions. The idea of customizing dietary, exercise, and even mental health strategies to fit an individual's unique biology and lifestyle holds immense potential. The healthcare field is starting to understand that blanket solutions often fall short, particularly in chronic conditions like diabetes. Imagine a world where a diabetic patient could undergo a simple test, identifying their metabolic type, microbiome profile, or even genetic markers that predict their response to certain foods. This approach could offer targeted advice, perhaps a higher protein diet for one person, or an emphasis on interval training for another, guiding each patient toward the specific changes that will benefit them most. Such tailored interventions would likely improve both adherence and outcomes, bridging the gap between medical theory and real-life applicability.
Dr. Mihira, how could this personalized approach to reversing diabetes be developed further to make it accessible to more people?
One key step is leveraging technology, particularly artificial intelligence, AI, and machine learning, to make sense of the immense variability among patients. Developing a digital platform that collects health data, like dietary habits, activity levels, genetic information, and real-time glucose readings, could enable algorithms to generate customized health plans. While we have wearable devices that track glucose, sleep, and steps, integrating these into a centralized system that uses AI to process this data into actionable recommendations is still in its infancy. Collaborating with tech companies and integrating electronic health records could democratize access to this personalized care, particularly if it's subsidized or covered by insurance. There's a future where, potentially, each patient has a real-time digital health assistant designed to adjust their lifestyle plan dynamically, based on ongoing data.
Where do you see the role of these advancements in reversing diabetes in the future, Dr. Mihira?
I believe these innovations will redefine diabetes management, perhaps even dissolving the term chronic condition for type 2 diabetes in some cases. As personalized approaches become more refined, early intervention may help individuals at risk avoid diabetes entirely. For those already diagnosed, these advancements could mean more effective, less invasive treatments. Imagine a scenario where, rather than focusing solely on medication, the healthcare system emphasizes early, individualized lifestyle interventions supported by data-driven insights. Moreover, the psychological impact could be transformative. Instead of feeling trapped in a lifelong condition, patients could feel empowered to manage and even reverse their diagnosis. This paradigm shift in treating diabetes could pave the way for similar approaches in managing other chronic diseases.
Now look at Extract 2. Questions 37 to 42. You hear a nurse, Claudia Klaus, on the ambulance care facilities at Mihira Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. Thank you for joining me today. I am Claudia Klaus, a nurse at Mihira Healthcare Institute, and I am thrilled to discuss a topic close to my heart, the advanced ambulance care facilities that Mihira Care offers. The innovations we are introducing in emergency and ambulance care represent a significant evolution in how we deliver healthcare services. In this presentation, I will be explaining the critical features of our ambulance services, their impact on healthcare delivery, the specific problems they address, future developments, how we will achieve our vision, and the stages in this transformation journey. At Mihira Care, we are committed to developing ambulance care that goes beyond traditional emergency response. We have equipped our ambulances with top-of-the-line medical technology and telemedicine capabilities. Our vehicles are fitted with compact, hospital-grade ventilators, defibrillators, and advanced patient monitoring systems that allow real-time health tracking. This setup enables paramedics to manage complex cases in transit, significantly improving survival rates for critically ill patients. Telemedicine integration allows our on-the-ground team to consult with specialists at Mihira Care in real time, regardless of location, providing swift intervention decisions and the best possible care en route. Moreover, Mihira Care's ambulances are built to offer a trauma-stabilizing environment, from oxygen supplies and intravenous setups to emergency childbirth kits. Each ambulance is staffed by highly trained paramedics and nurses skilled in administering advanced life support. Our service isn't merely about transportation, it's about bringing the quality of Mihira Care to patients on the move. The improvements at Mihira Care extend beyond technology. They represent a rethinking of how healthcare is delivered. Ambulance care traditionally focuses on minimizing transport times, but at Mihira Care, we are focusing on patient care during transport. This is a paradigm shift where we provide continuous healthcare, bridging the gap between the patient's location and the hospital. Such advanced care capabilities mean that essential care isn't delayed until patients arrive at the hospital, which is critical for time-sensitive conditions such as stroke, cardiac arrest, and severe trauma. This facility significantly reduces mortality rates and hospital readmission rates because patients receive prompt treatment that stabilizes their condition. Furthermore, these facilities help relieve congestion in emergency departments by ensuring patients are either stabilized before they arrive or even treated sufficiently in the ambulance itself, ready for a more appropriate ward on arrival. Mihira Care's innovations thus streamline emergency care delivery, improving efficiency, quality, and outcomes. One of the major issues Mihira Care aims to resolve with its ambulance care facilities is the delay in intervention for patients experiencing life-threatening conditions. In conventional ambulance setups, emergency care can only begin in earnest upon hospital arrival. However, Mihira Care's ambulance technology and telemedicine support eliminate this delay, enabling paramedics to start treatment sooner and with confidence backed by specialized guidance. Another issue is the gap in care quality between rural and urban areas. Patients in remote areas often face long waiting times and poor access to emergency care. Mihira Care's telemedicine-equipped ambulances can bring specialist advice directly to these patients, reducing disparities in care quality across different regions. Lastly, Mihira Care's comprehensive ambulance services aim to alleviate the logistical challenge of emergency department congestion. By stabilizing patients or even fully treating minor emergencies en route, Mihira Care minimizes unnecessary load on emergency rooms, ensuring beds are available for patients who truly need immediate care. As we continue developing our ambulance services, Mihira Care is investigating the integration of AI to support decision-making in the ambulance. AI-driven systems will analyze real-time patient data and provide recommendations, assisting paramedics in delivering accurate, evidence-based care. Additionally, Mihira Care is exploring partnerships to implement drones for initial response in hard-to-reach areas, delivering essential supplies until ambulances can arrive. These future developments will further close the gap in emergency care access and quality. In the future, Mihira Care envisions a comprehensive network of mobile healthcare units, not just for emergencies, but also for preventive care and chronic condition management, making healthcare accessible to even the most remote areas. To achieve this vision, Mihira Care is focusing on 4 primary areas: staff training, partnerships, technological upgrades, and public awareness. Our paramedics undergo rigorous training to handle advanced medical equipment, while our partnerships with tech firms ensure we have access to cutting-edge technology. Further, by engaging with the community through awareness campaigns, Mihira Care emphasizes the importance of early intervention and correct response during emergencies. Mihira Care believes that by combining technology, skilled personnel, and community collaboration, we can create a healthcare infrastructure that is not only reactive but also proactive. Through these efforts, Mihira Care is working to create a healthcare model where patients receive the best possible treatment, from the moment of emergency through to recovery. The first stage is identifying and addressing training needs, ensuring that paramedics and nurses at Mihira Care are equipped to operate the complex equipment within ambulances. The next stage involves equipping each ambulance with standardized technology, while the third stage focuses on integrating telemedicine, enabling real-time specialist consultations. Finally, we aim to establish a continuous feedback loop where we evaluate outcomes, gather data, and refine our approach to constantly improve the quality of care provided. This structured approach allows Mihira Care to set achievable milestones, building a system that can adapt to advancements while consistently improving the healthcare experience for our patients.
That is the end of your OET listening test. Now check the answers.